may have been told to just relax or take a deep breath in the past. However, instructions aren't always helpful if you don't know exactly what to do or why. A specific kind of breathing, called diaphragmatic breathing, is a skill that you can use to improve your mental and physical health. Diaphragmatic breathing sends air deep down into the lungs, expanding your diaphragm and putting pressure on the vagus nerve. Engaging this nerve can turn down your stress response or your fight, flight, freeze response and turn up the rest and digest response. Because of how this process impacts your digestive system, it can also help with reducing some specific GI symptoms. Let's learn how.
Place one hand on your chest and the other one on your belly. For now, just focus on breathing normally, noticing how your hand on your chest and belly both move as you breathe in and out. When you're feeling stressed or exercising, you might notice a lot of movement in your chest and shoulders. Now, for diaphragmatic breathing, you're going to focus on pulling air deep into your lungs and expanding your diaphragm, the big muscle that separates your chest from your abdomen. As you pull air into your lungs, it's important that you let your belly expand in all directions like a balloon. This will feel different from how you normally breathe when resting. With your hands on your chest and belly, try to keep your shoulders still and let your bottom hand move up or out with each breath in. Let's practice. In a moment, I'm going to instruct you to breathe in slowly for 4 seconds, hold for 1, and then exhale out slowly. We exhale longer than we inhale to make sure that all of the air is getting out of your lungs and to increase the relaxation response. Breathe in, 2, 3, 4, hold. Breathe out, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Breathe in, 2, 3, 4, hold. Exhale longer, 2, 3, 4, 5, 6, 7, 8.
The sensation of diaphragmatic breathing may be new. It can feel a little tight or uncomfortable if you aren't used to it. Try to allow yourself to feel these new sensations without shying away from them. In the long run, learning to be relaxed and present despite feeling uncomfortable will help you manage both stress and GI conditions. If this skill was too difficult, try loosening your pants or leaning back further while you practice. It may take time to get it right.